Hi, I'm Amanda Olson, and I'm a doctor of physical therapy and certified pelvic floor rehabilitation specialist. And I see patients in the clinic that have all sorts of different issues, ranging from urinary incontinence to fecal incontinence to pelvic pain and pelvic organ prolapse. And sometimes when a patient comes in for a diagnosis like urinary incontinence, they also want to talk about sexual dysfunction and issues that they're having in the bedroom of it just not being as pleasurable, or maybe they can't feel anything at all. And they are interested specifically in exercises that are for vaginal tightening. And the good news is that a Kegel exercise is a contraction of the pelvic floor muscles. So here's the pelvis. And everything that you see in red here on the superficial layer and deep layer here, a Kegel exercise is a contraction of those muscles. And by strengthening those muscles, it will improve the tone around the vagina. So looking at how we're made, our bladder sits in the front of the pelvis, right like that. And then the vagina and the uterus is right behind it. So still squeezed into that pelvic bowl. And then the rectum is right behind that. So these organs are all seated in the pelvic bowl like this. So bladder in the front, uterus and vagina coming down right behind it, and rectum in the back. And the pelvic floor muscles on the superficial and the deep layer support all three of those organs. So even if you've had a hysterectomy, your uterus is gone, but your vagina is still there. That is the cylinder canal. So by doing Kegel exercises of squeezing and lifting the pelvic floor muscles, we can increase the tone around that vagina, which can increase the pleasure for females and for males. So by practicing Kegels, you can increase that tone and help make things better in the bedroom.